Hello, this is Dr. David Durst again. We're going to do another short video for our website today. What we're going to demonstrate for you today is a Juvéderm injection into what we call the tear trough area. Melissa is our nurse and she would like to have this area treated. It is an area that causes a little bit of a tiredness look to the eyes. In her situation, she is not severe enough yet to need lower eyelid surgery called a blepharoplasty. What we can do in some situations when people have a little bit of shadowing under their eye before they really need the blepharoplasty procedure is to do a Juvéderm or Restylane injection into the tear trough area to plump it up just a little bit. This is a specialized use of fillers. The official approved use of fillers are for the folds here called the nasolabial folds, but physicians who are trained can use fillers in other areas at their discretion, and of course it takes experience to be able to do this. This is one of the trickier areas to do. We will be using only a small amount of the Juvéderm at this time because overfilling this area looks bad. I'll show it to you though on the video. Also, we're going to have some pictures for you, and we have specifically taken these pictures with the worst possible lighting so that we can highlight what we're trying to correct on Melissa. In normal lighting, you really don't see it quite the same as you will in these fairly dramatic preoperative pictures. It should be also one of those things that you realize is that Juvéderm injections into the tear trough are relatively subtle. Most patients can tell that they look better and it's very well liked, but it's not going to be something where everybody who knows you is going to be able to tell what's been done. If your issues are that severe, you probably need a blepharoplasty instead. So we'll show some photos and then we'll go to the procedure room and show you how we do this injection. I hope you enjoy this video. We'll show some after pictures a couple of weeks from now so that you can see what the effect is when we edit this small video together. Thank you again. Melissa is going to do Juvéderm in the tear trough area. Hand me a Q-tip so I can show everybody where that is. You'll see some shiny stuff under her eyes. Actually, that is some anesthetic cream that we put on there because we have to numb this area. But the area that we're going to treat with the Juvéderm is really right in this area here. And so I'm going to actually augment that with just a very small injection of local. We're going to let that work for probably a good 10 minutes because this is a little bit tender as far as an injection goes. So we want this area kind of numb. And we're going to let that work for a bit and then we'll do the injection itself. We'll get that shiny stuff off there too. Okay, we've let the local anesthetic work on Melissa now for about 10 minutes. And the lighting may be such that you can see that the slight depression is still noticeable in the tear trough region. Again, this is an advanced treatment that's really only useful in carefully selected patients. Further, it is tricky. What we definitely don't want to do is overfill this area. And so what we'll do is we'll fill it the way we think it needs to be filled today. But if we needed to, we could easily add a little bit more Juvéderm in a couple of weeks when we were certain that all the swelling had gone down. This is also a fairly long-lasting procedure in this particular location. It actually works for probably 18 months on average. It's a very subtle thing, but it typically looks very nice. And afterwards, she won't have to do really much to it. We'll give her some instructions here in just a second. The Juvéderm is a material called hyaluronic acid. It is a pre-packaged filler that comes in a syringe. There is another company that has a similar product called Restylane. They basically work exactly the same. It just happens that today we have Juvéderm in our cabinet and that's what we're going to use. So we're going to go ahead and get started. This area should be very numb for her, and if not, we'll stop and put some more local anesthetic in. Okay, here we go. How is that? Is that okay?
Mm-hmm.
Okay, Debbie, hold a little pressure on that for me. Come around to this side. You might have noticed that we were injecting fairly deep, and in fact the correct placement of this is down onto the bone. Normally fillers are placed in the very superficial layers, really just right at the bottom of the skin, but in this location you want to put this on very deep, and so it's a little bit tricky. You have to be exactly careful what you're doing. I'm going to go ahead and do the other side, then we're going to take a look at some things and see if we need to touch it up a bit. We've used about 0.2 cc's of material on that side. Okay, you ready?
Mm-hmm.
Yeah, we're going to hold pressure on that for a second, and then we're going to take a look at it again. So now we're holding a little pressure on this. We're holding gentle pressure to try and keep it from bruising very much. We don't want to push too hard in this area because we might actually push the Juvéderm out of position, so we're being very cautious with that. And then in just 1 second we're going to go ahead and get some ice on this so that it doesn't bruise very much. We'll have her keep it iced down for most of the rest of the day. There are 2 other little places that we're going to do, and I'm just going to show them to you, although I'm not going to do the injections on the video. She has little bitty smile wrinkles right down here on each side, and we're going to fill those up because we have just a little bit left, and so we'll do that in a minute, but we're going to get some ice first. Thank you for watching our video. I hope you find this helpful. We're going to take some pictures in a couple of weeks to show you what this looks like, and hopefully we can duplicate that fairly horrible lighting that we had in the initial pictures, and you'll be able to see a definite difference. Thank you for watching our video.